Perfect. Thank you.
Okay, sorry. Apologies, everyone. Okay, hi, everyone. Thank you so much for joining us this afternoon, morning or evening, wherever you're from. We're really glad to be able to have somebody from the Global Fund Secretariat to share with us the results from the Global Fund's investments in 2023. And we're going to hear a lot more about it. But we welcome all of you. My name is Rachel Ong. I'm from GFAN Asia Pacific, and I'm based in Singapore. And just a kind reminder to everybody, this session is recorded and will be put on our website for everyone to see afterwards. So I'm going to hand this over to Ernest. Ernest is the Communications Manager at the Global Fund Secretariat in External Relations and Communications. And Ernest, over to you to share with us the exciting information that you had with us.
Thank you, Rachel. Thank you, everyone. I'm going to share my screen. Let me know if you see that. I'm going to make it full screen. Can you see that? Can you see? Okay, good. Good. I guess I want to start by thanking all of you for being here, but also most importantly for the great role you play in supporting us at the Secretariat. We, at this time when we share the results report, we always want to remind people that these are not the Global Fund results. These are the results of the whole partnership. And we want to celebrate what we have achieved together. We want to thank all the partners who work with us in helping achieve these results. So in a nutshell, we these results are you should fully own these results because they are really and you see across the report we are talking about the partnership having achieved this. Now, I want to very quickly share something new in terms of how we have packaged this result. Initially, those of you who know this results report know that it would come in one booklet, but in supporting our audiences to actually be able to access this better, we packaged this results report in a different manner. The first package or the first booklet, we are calling it Summary and Key Results. And this is available, of course, in print, but more importantly for you who may not have the print version, also online, there is a Summary and Key Results element. And this is basically a summary of the key elements that have been tackled in the report and all the key results, the major results, the big numbers of the report. And then, of course, we have standalone chapters, HIV, TB, malaria, HCS, or health and community systems, colliding crisis, and investing for impact. That's important for us because, of course, all of us want to read all the results report, but I know particular, different people might be interested in different elements of the report. So we packaged so that if you want to access malaria or HIV, you could go directly there, but also you could read the whole report. Now, the big number that we update every year, which you have seen, is the lives saved number. And this year we are reporting 65 million lives. This is an update from 65 million. This is an update from 59 million lives that we reported last time. Now, the big thing, the big message we usually want to communicate is, and that's what the report is saying, you will see quite a few elements of case studies across the report. That these are not just statistics. These are not just mere numbers. These are people who continue to access HIV services, treatment and prevention, malaria, of course, TB, and those lives saved numbers are parents, their teachers, their workers who continue to build their community and contribute to their economies. So that's the number we are reporting now. The three key numbers every year that we report are these. Sorry, just a second. And there's a bit of a distinction I'm going to give here. The three key numbers are 65 million lives that are mentioned. This is, of course, cumulative over the last 22 years. The Global Fund Partnership has saved 65 million lives. Now, another cumulative number is people on ARVs. The 25 million we are reporting here, of course, when you put people on treatment, you want to retain them on treatment and you want to continue to increase the numbers. So these are the number of people that we are on ARVs in the countries where we support. But when you get to TB, we report annual numbers. So 7.1 million people treated for TB in 2023 and 227 million mosquito nets distributed in 2023. Those are not cumulative numbers. Now, what are the key messages? The key messages of this results report, I'll touch on a few because I know time is limited. Now, the first one is the one, the key number, 65 million lives. But more importantly, what we are saying in this results report is that we can now report that we have fully recovered from the impact of COVID-19, and actually in different treatment and prevention services, we are back on the trajectory we were. We have regained that trajectory that we were on before COVID hit us. Of course, that is testimony to all the key partners who've played part in that, in really investing and reinvesting C19 funding. First of all, investing to make sure that, COVID-19 did not have as huge an impact on HIV, TB, and malaria, but also reinvesting to make sure that we continue to accelerate progress. Now, sorry, just a second. Now, the other message we have here is that we continue to, and we talked about C19, I just mentioned C19 reinvestment, to really accelerate our investments in health systems. And in this results report, we are reporting that we have invested 1.8 billion, the highest ever amount in a single calendar year in health and community systems. But we're taking that forward. For the first time in this results report, we are able to show that besides the direct investments in health and community systems, our funding in the fight against HIV, TB, and malaria has a huge impact in health systems by freeing up resources and capacities. Let me explain that very quickly. Essentially, if you go to a clinic in one of the many countries where we invest, we know the very, very tough days in HIV when not many people are on treatment, in the fight against HIV when not many people are on treatment. Essentially, you'd go into a clinic and find so many people there receiving treatment for AIDS-related illnesses. But once, and the same applies to malaria, before we started investing, of course, prevention, mosquito nets, but also we know that with community health workers, we have people going into communities and actually testing and treating. Now, what that means is that we are freeing up resources so that health facilities can be able to deal with other challenges. So in this report, we've been able to capture the resources that have been freed up by our investment in, we are starting with HIV, and actually in the investment case, for those of us who follow, we are going to be able to show across the three diseases. But in this report, we are talking about hospitalization days averted, outpatient visits averted. And actually, we even have a cost saving, 85 billion in cost saving over the last 22 years. Now, I think the other key message is how we have continued to contribute very strongly in market shaping. Our market shaping efforts continue to make a big difference in supporting more people to access services, because once you institute market shaping efforts, essentially what you're doing, you're cutting prices, and we are talking about reducing prices by 25% for preferred first-line HIV treatment, 20% for diagnostics for TB, or diagnostic test cartridges for TB, by 30% for short-course TB preventive treatment, and 55% for bedaquiline. So that's a key message. Our efforts, because of our market shaping efforts, a kind of reduction in prices, which of course allows us to invest more in other areas. Two other elements, key results, key messages for this results report is that we continue to show why this partnership is a partnership of choice. Because of how we are able to show how agile we've been, or we were with COVID, but also with other crises. In this report, we are talking about conflict, we are talking about climate change, we are talking about human rights crisis, and how the Global Fund has been able to be agile, to support countries to really protect the gains we have made across the 3 diseases from those crises, but also actually continue to accelerate that progress. Let's talk about HIV very briefly. And one of the key numbers that we report in this results report is a counterfactual. And basically what we do is we assume what would have been the state of HIV if the Global Fund partnership would not have been there. And in this report, we are able to show that AIDS-related deaths would have increased by 115%. Now we are seeing a reduction of 73%. So that's the gap we are covering. And when it comes to HIV, new HIV infections, these would have increased by 119%, and now we are seeing a reduction of 61%. The key numbers is how, for HIV numbers, is how in countries where the Global Fund invests, we continue to actually make great progress in terms of the 95 testing, treatment, and viral load suppression targets. And we named a number of countries that have hit those targets: Botswana, Eswatini, Kenya, Malawi, Rwanda, Zambia, Zimbabwe. So hitting those 95, of course, are very key to ending AIDS as a public health threat. I think the other element, a new number that we are reporting that I should mention here, very quickly, is that we have a new number in countries where the Global Fund invests. The number of children orphaned by AIDS decreased by 26% between 2010 and 2023. And you can, of course, see other numbers. Now, I mentioned about the point about freeing up resources, health and community systems resources, freeing up health systems to be able to tackle other challenges. And we have been able to actually use it. We have always been talking about this as something that we know is a fact, but in this results report, we are able to report. And there is this graphic that shows the biggest gains are in sub-Saharan Africa, or the biggest gains in freed up resources is in sub-Saharan Africa, Europe and Central Asia, Of course, you can see Asia, East Asia and Pacific, Latin America, and South Asia. That's how you can see the number for, Asia Pacific, East Asia and Pacific there, 124 million in terms of hospitalization days avoided. Let me move on to TB in the interest of time. And again, we have that counterfactual that I shared. And very quickly, the TB story is not as amazing as the HIV one, but it's still quite remarkable. And you see that malaria is actually not doing as well as TB and HIV, especially when it comes to cases. But let me talk about TB very quickly. If we had not been there, if this partnership had not been at work, TB deaths would have increased by 129%. Now we are seeing a decline of 36%. Again, not as remarkable as HIV. Now, when it comes to cases, they would have increased by 38%. Now we are seeing a reduction of 1%. Now, it's important to talk about per capita, when it comes to rates, because of course, when you tell the story of TB and malaria, it's not as positive when it comes to actuals as compared to the HIV. But actually, when you do per capita, when you do rates, because we are factoring in population growth over the years, it's still quite a remarkable story. Now, for TB, I think very quick things to highlight again. Number one is how the Global Fund continues to invest in these innovative packages, innovative tools that have accelerated a number of key indicators, including finding missing people with TB. And we are talking about, so that is an approach, an innovative approach. But of course, you can talk about tools, mobile diagnostics, AI-powered computer-aided detection software, and digital chest X-rays. Another new area that we have reported is post-tuberculosis lung disease. We know that TB takes a long time to be treated and actually has quite a few side effects. And this post-TB lung disease is a big deal, and it's one that we are reporting. We are reporting here, essentially saying that in 2023, efforts were extended to address post-tuberculosis disease. This is a new area that we are really focusing on. Now, malaria, very quickly. If you look at these graphics for malaria, they're actually even less impressive when you look at the actuals. Of course, the rates speak a different disease, a different story. But trends in malaria deaths, if we were not there, they would have increased. Malaria would have increased by 90%. Now we are seeing a 28% reduction. When it comes to cases, that would have been increased by 79%. Now we are seeing an increase of 2%. Now, one challenge there, I talked about per capita. The fact that we are not keeping up very well when it comes to coverage, of all the populations that are exposed to malaria. So that's a key thing. We need to keep up that effort. Now, I want to move forward to health and community systems. And as I mentioned, one of the key things that we are reporting in this report is how we have accelerated our investments in health and community systems, especially using the C19RM funding. And these are the 5 areas where we have seen very remarkable growth: human resources for health, lab systems, health, product and waste management, surveillance system strengthening, and medical oxygen. We are really stepping up in those areas. Now, under health and community systems, we wanted to, of course, talk about our procurement and supply chain. Of course, you know, we are very we invest a lot in health products. We procure 2.5 billion, so we have a number you can run with, 2.5 billion worth of health products each year. Now, 1.34 billion in 2023 went through our PPM, and it supported 81 countries. But it's not just buying products, which is why the 202 million in 2023 to strengthen supply chains is important. That's a very important element when it comes to transition and sustainability. Now, in terms of market shaping, I talked about market shaping earlier, but one thing I want to highlight, one key element to highlight, is that by 2023, the Global Fund and partners, or our partnership, had negotiated breakthrough and ARV pricing to be under $45 per person per year. Now, that is a remarkable feat. When you remember that in 2002, when the Global Fund started, when this partnership started, the price per person for ARVs per year was over $10,000. Another element, and I left this in, of course, I had to reduce the slides. I know this is key for Asia Pacific, is UHC. A new analysis shows that in the last 2 decades, investment by the Global Fund Partnership have significantly accelerated progress towards achieving UHC. And listen to this. The Global UHC Service Coverage Index score increased from 45% in 2000 to 68% in 2021. This improvement is largely 61% of that driven by the scale-up of ARV therapy or antiretroviral therapy. In addition, the scale-up of TB treatment and mosquito nets coverage ranked as 5th and 6th as main drivers of this overall progress. And essentially the message there is our investments in HIV, TB, and malaria make a huge contribution in accelerating progress towards UHC. Now, colliding crises. We are investing in a world of colliding crises, human rights, anti-gender, anti-rights movements. We're talking about climate change. We're talking about conflict. And we are showing how in this era, in this environment of colliding crisis, how we continue to invest very, very strongly in certain areas to mitigate the progress we are making, to mitigate the gains we have made, and actually to accelerate progress. Breaking down barriers. I know that is of interest to many advocates. We shine a light on breaking down barriers and how we have invested in at least 24 countries to be able to protect, to break down the barriers, gender and human rights barriers to access to treatment and prevention services across the 3 diseases, especially HIV and TB. Now, you see a number there that we have increased our investments in this initiative more than tenfold since 2017, reaching 200 million in 2023. The other element to mention is, of course, conflict, and I talked about that. And I think it's important to say the amount of money that this partnership invests in countries that have conflict, or what we call in Global Fund language, COE, challenging operating environment. That's a phrase now we are replacing with countries in humanitarian crisis. At least $22 billion go to countries affected by humanitarian crisis, or have gone to countries affected by humanitarian crisis since 2002. Emergency funds, this is something we would want to highlight, and you can see how our emergency funds, which is of course not very old, it was established in 2014, and this is how we have distributed our investments our investments in these emergency funds. natural disasters and extreme weather and climate events, conflict, displacement, and political crisis. Now, climate change, and I want to very quickly, I know I need to wrap up. This is an area we are really stepping up, and in two ways. One is in adaptation. Now, in adaptation, the areas where we are investing in is disaster risk management for health, vulnerability risk and impact assessment, disease surveillance and early warning system, climate sensitive disease control in vulnerable areas. Now, it's not happening in many countries, but we've been able to do this in some countries, and we have good stories for that. And then there's the area of mitigation. The area of mitigation when it comes to climate change, we're investing vigorously in solar projects. For instance, in the last 7 years, we have supported solarization of more than 1,000 health centers and storage facilities in 15 African countries, including Zimbabwe and Zambia. And now look, in GC7, over 20 countries have included installation of solar panels on health or storage facilities in their funding requests. Now, investing for impact, this is the last chapter, and I'll finish up. Now, two elements, a number of elements here. This chapter shows the scale of our investment so far since 2002. 65.4 billion have been invested by this partnership in more than 100 countries. We continue in the last 3 years to invest in a record way, more than $5 billion again in 2023. And of course, our biggest donors are public donors, private sector also a growing investor in this partnership. But of course, domestic financing remains a key element of that. Now, how is our funding distributed? You see this map. Of course, a large part of that goes to Sub-Saharan Africa. Asia and Pacific is number 2, 19%. And then you can see the others, 3% Latin America, 3% Eastern Europe and Central Asia, 2% North Africa and the Middle East. A new element we have in this report, we never had this before, is showing where does our funding go in terms of profiles of where we invest. Of course, we invest with governments, ministries of health, multilaterals and INGOs. Sometimes there are countries where we have to use, for instance, UNDP and other international NGOs, but also we are able to show where our money goes to local and community-based organizations. And that is how it's distributed. And we have, this is 5. Basically, you see we are keeping around 57, 58% going to government, 31% going to multilaterals and INGOs, and 12% going to local organizations. And this is how, of course, this is the Global Fund footprint in terms of international grants provided by the Global Fund. We are 28% for HIV. Of course, you would know that PEPFAR takes quite a big chunk there, but also there are many other bilaterals, which makes us 28%. TB, 76%, which shows how big we are in TB, but of course, it also shows why more investments are needed to be invested by the Global Fund in this area, because besides, there are not many international investors there. So we are 76% and 62% when it comes to malaria. Very quickly, how is this report packaged? What kind of elements can you make use of? We have the book that I was talking about in English, but it's now going to be available in the next week also in French. And it's, these standalone chapters and the summary and key results package that I presented at the beginning. We have at a glance. This is in 10 languages. You can see those languages. This is basically a 2-pager that really summarizes what this report is about. We have an interactive web page on our website. You can go and interact with that. Social media toolkit, I'm sure you received that. Social media tiles, which we continue to publish on our social media. We have a video that I'm sure came in the social media package. There was a news release that published. There was an op-ed by Peter. There's a slide deck, and I'm going to share this slide deck when I'm done. And that slide deck is going to also be available in French, and the results report full book also available in French in the next week or so. Thank you very much. I think I'll stop there and welcome questions.
Great, thank you so much, Ernest, for your time. And thank you for some of the very important information that you've shared with Asia and Pacific. We'll definitely be in touch with you to get more disaggregated information, I think, in terms of the advocacy work that we'll be rolling out in terms of the replenishment for next year. But I'm going to just check with our participants. I see your hand already raised. And I see a question in the chat box, but let me hand this over to Sonal first. Sonal, please introduce yourself before the question or comment. Thank you, Sonal.
Thank you, Rachel. And thank you very much for the presentation. And I asked this question as a friend of Global Fund. So that means I really want to know the information. When you presented about community, it was more on RSSH rather than on the community. It was everything about supply chain, health workers, setting up laboratories. And I don't hear anything about community actually in the entire report. And so I'm wondering, is there a political decision not to call it RSSH and kind of, say that, okay, people's lives change because, and which is also okay. I understand when we are talking about donor countries and all that. And my second question is, in some ways, then the report might not, the investment case might not reflect the strategy of Global Fund if we don't have enough about the key issues that Global Fund talks about. So these were the two things I wanted to ask, if you can respond to them. Thank you.
Thanks so much, Sonal. I'm going to move to Blessy as well before handing this over to you, Ernest. And in the chat box, we have a question from Shibu asking why there was only 28% HIV. I think he's referring to that slide that you presented on. Blessy, please introduce yourself.
Yeah. Thank you, Rachel. My name is Blessy Kumar. I'm with the Global Coalition of TB Advocates and also the chair of the GFAN AP. Thank you so much for this conversation, making it possible, and also for sharing the report, the Global Fund colleague. Thank you so much for that. I just wanted to highlight a couple of things. One is, you did share about the investment into addressing human rights challenges. If you see in our region, the entities or the groups that are working towards removing human rights barriers are the communities. If you look at it, governments will not work towards removing those barriers to an extent that we would like to see, because it could be the policy of the government. So it's a bit like, you're expecting them to sort of negate or do something that they've agreed to against that, which will never happen. So in this scenario, it's the communities that will be moving. Our work as GFAN AP and GCTA over the past years has highlighted the numerous challenges our region has in this area. And unless and until communities are supported, protected with some mechanisms, I guess that also boils down to support and funding, we can't expect these barriers to disappear completely. So that's my point number one. Secondly, again, I know my friend Sonal has already mentioned, the investment directly to communities is really lacking here. I know you've talked about a lot of things. Commodities, medical supplies are extremely important. But if you do not have a community that is prepared and advocating for its acceptance at the ground level, that will be a waste of time. And we are and resources, and we are seeing that with the BPAL that you talked about. It wasn't rolled out in one of the highest burden countries. Still, the community stepped in and advocated for it for over a year, and now we are seeing some momentum. So, and we have to learn from HIV. Why you talked so highly about HIV, very rightly so, but look at the amount invested in communities, in the movement of communities, in building that movement. And unfortunately, TB is still being seen as a medicalized problem. And unless and until we shift that and ensure that funding goes directly to communities, not to global entities that will then decide who gets what, but directly to communities working on the ground in our region. Thank you very much.
Thanks so much, Blessy. I'm going to move to the other questions I see in the chat box, and I'm going to ask people to raise their hands if they have further questions. I also just want to remind our participants that Ernest is here to share with us the results report. He's not responsible for the results in a way. So I think there will be more conversations that we need to have amongst ourselves to make sure that we're shifting and advocating for the policies to be implemented in the right place. But I also want to share with everybody that we have a colleague from the CRG department, Brice. Please raise your hand or share your information in the chat box and add on to anything that you would like to add after Ernest. Thanks so much, Ernest.
Hello, Rachel. Sorry, just
Yes.
clarification. I'm not from the Community Rights and Gender Department, but I'm from
apologies.
the Political
You're from,
and
yes.
Civil Society Advocacy. Yes, but I will put my contact information in there. And if there's some CRG related questions, I will make sure that they get to my colleague to provide some answers to that. Thank you.
Thanks so much, Brice. Over to you, Ernest.
Thank you. Thank you. So I will start with Shibu's question, which is about HIV. Why only 28%? To be honest, that's a very positive thing. Because even when it's 28% of the Global Fund funding going there, it's actually also our biggest investment. We are talking about 26 billion. And I know most of you will know very well the whole question about disease split at the Global Fund, which I don't want to raise here. But actually, HIV gets more funding than the other diseases when it comes to the Global Fund. And 28% is actually a very positive thing, because what it shows is that many people are investing in the fight against HIV. Of course, PEPFAR is huge, but beyond PEPFAR, all these many bilateral partners have HIV programs. So there is a lot of investments going there, which perhaps connects with Blessina's question. The advocacy for TB and malaria, of course, needs to continue to be stronger, because we need more investments in those areas. So 28% is actually the fact that 28% of the Global Fund, the Global Fund contributes 28% of international investments, is a very positive thing, because that is 26 billion. So it shows that investments in in the fight against HIV is huge, or investments are huge, and many people are interested in that area. I hope and I wish, that would also happen to the other diseases. Of course, we need to advocate for that. Now, moving on to communities. Now, I first of all realized I did not do it justice, because there are only so many slides. This was like 100 slides, so I cut it down to 40-something slides. So the report is richer than I presented it when it comes to communities. Now, we are changing from RSSH, we are changing the terminology from RSSH. In fact, part of that is sort of really openly recognizing the role of communities when it comes to that element of health systems. So we are actually calling that chapter Health and Community Systems. And in this particular, we are talking about systems. We are talking about all the community networks and infrastructure that have been built over the years to help or to support access to treatment, prevention services, and care in many places where we invest. So that's just explaining the terminology. It's true that there is more that needs to be done. You know, of course, the Global Fund is heavy on products. I told the story of our procurement, but it's for good reason sometimes, because you have to keep people on treatment. We have more than 20 million people on treatment for HIV. TB, you are treating 7.1 million people. Of course, there is an argument to be made. You could have invested before in community systems to prevent that. So there's more that needs to be done, and in fact, that is exactly what the Breaking Down Barriers initiative is trying to do. It's a recognition that the usual way of doing things, the biomedical approaches, will not work. And setting aside money, it's 200 million. That's the number I showed there since 2017. Of course, it could have been a bigger number. And so for those of us who write the results report, I produce the results report, I write the results report. We are providing you, and I'm not sort of inciting you against our CIG colleagues and other people. But what I'm trying to say is we are providing you material so that you can be able to engage and advocate and say perhaps there might be need for increase in resources in this area and that. But we, in this report, have a good profile of breaking down barriers and other community investments in community systems. And by the way, we could not actually be able to include everything in this area, even in the results report itself. There are new reports on breaking down barriers countries, and you can, Brice will connect you with our CRG colleagues who can actually share more about what is this 200 million we have invested there achieving, and what are other areas that we have been investing or we were investing in community systems even before the Breaking Down Barriers initiative. So I think the presentation I make here does not do justice to our investments in community systems. Having said that, there's a lot of work to be done. There's a lot of advocacy to be done. And my hope is that the members here, the people here, can use this report as a way to, as material to advocate for more investments in community systems. I hope I answered you there. Yeah, I think I got the questions. Let me know if there's another question or if there's need for clarification.
Thanks so much, Ernest. I think we can have time for another round of questions. I see a couple of hands up already. I see Daniel's hand up. But Daniel, give me a second. I'm just going to read the questions that I have seen on screen. There's one from Shri that's asking if the Global Fund is planning to add any other success indicators around malaria rather than using bird nets. Sonal commented about there's a systematic reduction in HIV, but not a mere percentage, which is not even actual total funds. And then there is a question that you sort of answered around your around the resources for breaking down barriers that have risen so high, but they haven't seen the impact or felt the impact or increase in investments that much in the case of Nepal. So Shibu has also asked a question around whether the Global Fund can create a mechanism of direct funding processes to community organizations. So Shibu, this is something that we're working really hard on in terms of the campaign that we're developing for the Asian Pacific region. So we'll be very happy to put you in touch with us. Sorry, not put you in touch with us, but be in touch with you in terms of some of the sharing and thoughts that we have. So Daniel, over to you. Please introduce yourself.
Yeah, thank you, Rachel. I'm Daniel. Thank you for the presentation. It's interesting result report that we have been listening or looking at the pictures. Looking at that, what I'm thinking right now is how we can use this result as tools of our advocacy, because this is become the advocacy. Because I agree what Lacey has been raising about to put the focus to the community programs and community manage that funding also. It can be two different things. Considering the situation right now, Global Fund now encourage countries level to prepare the transition plan for the sustainability, looking at potentially the difficulties on the CRD8 to mobilize the resources as expectation, although we don't know the budget, the total amount what we expect. Looking at grand cycle 9th, maybe will be there or maybe will never be there. So I'm thinking this is a good moment. Actually, this existing cycle, and especially for the egg grand cycle, how we can put a priorities to put the funding to the communities program for HIV, for TB, both of them especially, and managing by communities organization. And important to put allocation strongly for the community strengthening system for to prepare the sustainability of, although we thought of funding it will never sustain, but how we can mobilize resources through the advocacy in the country level. It becomes very crucial moment for the community to get more support from what we have been raising. Thank you. Sorry,
Thanks
I need
so
to add also, sorry, Rachel, how we can
much.
use also in the internal of the Global Fund Secretariat also, how you as a community communication representative or unit to use this report to internally to advocate in your secretariat to put the board put as a priority, excluding what we will have been doing also. Thank you.
Thanks so much. Ernest, over to you.
Thank you. I want to start with that one. I really appreciate Daniel, and good to hear from you. I remember meeting up in Bangkok. This advocacy point is a good one, and it's a brilliant point. And in fact, it's exactly why one of the reasons why we produce this report, to give advocates and other people material to advocate. Now, that advocacy is at so many levels. People like Rachel who know how, who have worked with the Global Fund Board, that's one area. In fact, it's perhaps less at the secretary. They still work for the secretary to do for sure. But at the board level, there is advocacy that is needed there, and communities have representatives. So that's a good point to be made. And this is material that you can use for that. But also, more importantly, let's also not forget country level advocacy, wherever you are, in whichever country, in your country. Because remember, for instance, GC8 will come. Now we are going into the replenishment. The CCMs will essentially be the ones, or at least they will play a very critical role in saying, how do we invest the resources that will come here? So I think at the country level, in many countries that you represent, there is going to be need for more advocacy at that level. And by the way, if you are interested in country level data, we have, as I mentioned, the interactive website that you can use to see where in different aspects a particular country is. And if you need more, we are happy to support, so that then you can do that country level advocacy. Yes, there is work for the secretariat to do, and there's work for the board to do. In particular, when it comes to the Secretariat, please address your questions to CRG, our CRG colleagues. Breeze can connect us. But also at the board level, this is the highest level decision making, at the Global Fund. So you're representative at the Global Fund. This is a good document at the Global Fund board. This is a good document, and these are good numbers for them to use for that kind of advocacy. Now, I should have mentioned, in terms of malaria indicators, mosquito net is not the only one. It's only because I couldn't give the whole report. But if you look at the report, there are many other indicators, malaria indicators, including some new ones, like for instance, this year we are reporting 15.5 million pregnant women received preventive treatment for malaria in 2023. 7.9 million structures were covered by IRS in 2023. 171 million malaria cases tested in 2023. And this here is a special one. 44.6 million children received seasonal malaria chemoprevention in 2023. 335 million suspected malaria cases were tested in 2023. So anyway, I was, of course, presenting this report in a nutshell. There's much, much more in there when it comes to indicators across the three diseases. I think I think, Rachel, you covered the question about direct investments in community, local organizations. And again, in this report, for the first time, we are giving you material, we are giving you numbers, we are giving our partnership numbers that they can use to do the advocacy that they need. This is a new number showing how money is divided between governments, multilaterals, INGOs, and local organizations. In fact, perhaps an important question is those local organizations, how can we dice that up even more to see how many or how much of that money actually goes to community organizations, or community-led and community-managed, community-based organizations. Thank you.
Thank you so much, Ernest. Can I just check if there are other questions that we may have for Ernest? But maybe while we're waiting, I'm going to do the very Asia Pacific thing. I'm going to ask people to switch on their videos so that I could get a screenshot of everybody that's attended this call for record purposes. Can I just invite everyone to switch on your videos while we are waiting for other additional questions, so that we can take a group picture together? Okay, I'm going to do this on the count of 3. Thanks, everybody. 1, 2, 3, smile. Okay, another one. 1, 2, 3, smile. It's really lovely to see all of you here. So I don't see any other questions, but I think, Ernest, I think the important point that we're trying to make is that for us to be able to use the results report, we hope to be able to be in touch with you for more disaggregated data from the Asia Pacific region, because I think this is we know we can pull that out from the website itself in terms of the country level data, but in terms of for us to do regional work in terms of advocacy to donors, we also need to demonstrate the impact that it has had in our region, for us to be able to do it better and more effectively. So it'll be really helpful for us to see that more clearly going forward.
Fantastic. Thank you. Yes.
Thank you.
2 things there, very quickly.
So,
Rachel.
Yes, please.
I'm going to make a bigger slide available that has much more than I presented, and I will remain available in case of any questions. Please reach out and I'll be happy to answer or connect you to the person who can answer the questions. Thank you very much.
Thank you, everybody. I don't see any other additional questions or
Rachel, I have
comments.
very short.
Yes, sure. Please go ahead, Daniel.
Yeah, and that's what I'm thinking. Whatever we have been talking about, discussing about, in the end, the proposal development is very depend on the communication, the CCM or country level with the portfolio manager. the country team in. So it's very important how to engage the country team to bring the understanding how important what we have been discussing become their priorities. So if not, it will miss in somewhere, because it's not CRG, it will not be other department, it will be the country team who directly will put this what they will put which one is become a priority for them to support in the country level. Thank you.
Thanks so much, Daniel. Ernest, any other closing remarks that you might have before I close the session?
No, just to thank all of you for the amazing work you continue to do, and to say, of course, we are starting the replenishment and we are going to count on all of you, and let us know if you need anything, reach out to us in comms. We are really, really happy to support this partnership to do the best job that they can. Thank you very much.
Thank you so much, Ernest. And so thank you everyone for your time and your commitment to the work that we're doing, not only at the country level to make sure that implementation goes to the right right places, but also to ensure that we are also mobilizing sufficient resources for the Global Fund as well as at the domestic level to be able to sustain the responses. I think more broadly, the results report does show that the Global Fund is achieving not only results in the 3 diseases, but more importantly, it's actually even showing results in primary healthcare. And that's something that's really important to show that the effectiveness of the Global Fund as a multilateral health institution. So thank you, everybody. We're going to be sharing more information around the work that we're going to be doing over the next few months as GFAN AP in terms of the campaigning that we're doing. We've already had very initial information from the communications team around the campaign that they're going to be rolling out very soon. So we're going to be working very closely with all of you and also our African colleagues and our other global colleagues in the donor countries to make sure that we're going to be able to raise as much as we can for the Global Fund next year in such a difficult time. But thank you everyone for your time, and we'll be speaking and reaching out to all of you very soon. Thank you, everyone. Bye.
Bye. Thank you, Ernest. Thank you, Rachel. Thank you, GFAN.
Thanks, Harry. Bye.
Bye.